The mysterious uterus. Let's dive into the world of uterine fibroids, a common condition that affects many women around the world. In this video, we are going to talk about 10 powerful herbs that can help alleviate symptoms of uterine fibroids, so hang on there. Uterine fibroids are like little growths that can develop inside the uterus, the muscular womb where babies grow. They're like tiny, non-cancerous tumors that can vary in size, shape, and number. Think of them like little clumps of dough that can form inside the uterus. Just like how you can shape dough into different shapes, fibroids can grow in different ways and sizes. Some might be small and harmless, while others might be larger and cause more trouble. Uterine fibroids, also known as leiomyomas, are benign non-cancerous growths that develop in the uterus, which is the lower part of the uterus. They are very common, affecting an estimated 70 to 80% of women during their reproductive years. But what are fibroids made up of? Fibroids are made up of muscle and connective tissue, and they can grow in different parts of the uterus, including 1. Submucosal. This is when fibroids grow inside the uterine cavity closest to the lining of the uterus. 2. Intramural. This is when fibroids grow within the muscle wall of the uterus. 3. Subserosal. This is when fibroids grow under the outer layer of the uterus. And 4. Pedunculated. This is when fibroids grow from a stalk and hang into the pelvic cavity. Fibroids can vary in size, shape, and number, and they can cause a range of symptoms including 1. Heavy or prolonged menstrual bleeding. 2. Pelvic pain or pressure. 3. Abnormal vaginal bleeding. 4. Bloating and swelling. 5. Constipation. And 6. Frequent urination. The exact cause of uterine fibroids is not known, but they are thought to be influenced by a combination of genetic and hormonal factors. They are more common in women who have never been pregnant, and they tend to shrink after menopause. While most fibroids are benign, they can sometimes cause complications such as 1. Heavy bleeding that can lead to anemia. 2. Fibroid tumors that can grow large enough to compress surrounding organs such as the bladder or intestines. And 3. Complications during pregnancy or childbirth. Treatment for uterine fibroids usually depends on the severity of symptoms and the size and location of the fibroids. Treatment options may include 1. Hormonal therapy to reduce symptoms. 2. Surgery to remove the fibroids or the entire uterus. 3. Non-surgical procedures to remove the fibroids or reduce their size. And 4. Medications to manage symptoms. It's essential for women who experience symptoms related to uterine fibroids to consult with a healthcare provider for proper diagnosis and treatment. Welcome back to Glow Up Facts. Do you suffer from uterine fibroids? Well, here are 10 herbs that are known to be beneficial for uterine fibroids along with their nutritional details, medical facts, and updated statistics. Let's begin. 1. Red clover. Red clover is rich in isoflavones, flavonoids, and saponins, which have anti-inflammatory and antioxidant properties. Red clover, a type of herb, has been traditionally used to help alleviate symptoms of uterine fibroids, including heavy menstrual bleeding, cramps, and bloating, due to its high concentration of isoflavones, which mimic the effects of estrogen in the body and can help reduce fibroid growth and size. A 2016 study published in the Journal of Ethnopharmacology found that red clover extract significantly reduced the size of uterine fibroids in mice. 2. Turmeric. Turmeric contains a powerful compound called curcumin, which has been shown to have anti-inflammatory and antioxidant properties that may help reduce the size and alleviate symptoms of uterine fibroids by inhibiting the growth of fibroid cells and reducing inflammation. Additionally, curcumin may also help to improve uterine blood flow and reduce the risk of fibroid-related complications such as heavy bleeding and pain, making it a potential natural therapy for women with uterine fibroids. A 2018 study published in the Journal of Women's Health found that curcumin supplementation reduced the symptoms of uterine fibroids in women. Number 3. Dong Quai, also known as Angelica sinensis. Dong Quai, a Chinese herb, helps alleviate symptoms of uterine fibroids by promoting blood flow to the uterus, reducing inflammation, heavy bleeding and cramping and pain, and improving uterine function, which can help to shrink the fibroids and reduce their size. Additionally, Dong Quai's antioxidant and anti-inflammatory properties may help to prevent the growth and spread of fibroids, making it a potential powerful therapy to traditional treatments for uterine fibroids. A 2019 study published in the Journal of Ethnopharmacology found that Dong Quai extract significantly reduced the size of uterine fibroids in rats. Number 4. Licorice root. Licorice root has been traditionally used to help alleviate symptoms associated with uterine fibroids, including heavy bleeding, pelvic pain, and mood swings due to its anti-inflammatory and antioxidant properties. The root's active compounds, such as Glycyrrhiza, may also help to reduce fibroid growth and shrink the size of the tumors, making it a popular natural remedy for women seeking alternative treatment options. A 2017 study published in the Journal of Women's Health found that licorice root extract significantly reduced symptoms of uterine fibroids in women. Number 5. Peppermint. Peppermint oil has been shown to help alleviate symptoms of uterine fibroids such as pelvic pain and bloating by relaxing the uterine muscles and reducing inflammation in the pelvic area. Additionally, peppermint's antispasmodic properties help reduce the frequency and severity of menstrual cramps associated with uterine fibroids. A 2019 study published in the Journal of Clinical Nursing found that peppermint oil significantly reduced symptoms of dysmenorrhea, menstrual cramps in women. Number 6. Ginkgo Biloba. Ginkgo Biloba has been shown to help alleviate symptoms of uterine fibroids by improving blood flow to the uterus, which can reduce the size and discomfort of the fibroids. Additionally, Ginkgo Biloba's antioxidant and anti-inflammatory properties may help reduce the growth and proliferation of fibroid cells, making it a potential complementary therapy for managing uterine fibroids and also heavy menstrual flows. A 2018 study published in the Journal of Ethnopharmacology found that Ginkgo Biloba extract significantly reduced symptoms of uterine fibroids in women. Number 7. Ashwagandha. Ashwagandha has been traditionally used to help alleviate symptoms of uterine fibroids, including pain, bloating, and heavy bleeding by reducing inflammation and promoting relaxation in the uterus. Additionally, ashwagandha's antioxidant and anti-inflammatory properties may help to reduce the growth and size of fibroids, making it a potential natural therapy for managing uterine fibroids. A 2019 study published in the Journal of Ayurveda and Integrative Medicine found that ashwagandha supplementation reduced symptoms of uterine fibroids in women. Number 8. Ginger. Ginger has been traditionally used to alleviate symptoms associated with uterine fibroids such as heavy bleeding, pelvic pain, and cramping by reducing inflammation and improving blood flow. Additionally, ginger's anti-inflammatory properties may help to shrink the size of fibroids and reduce their growth, making it a potential natural remedy for managing fibroid symptoms and potentially reducing the need for surgery. A 2018 study published in the Journal of Women's Health found that ginger supplementation reduced symptoms of uterine fibroids in women. Number 9. Motherwort. Motherwort has been traditionally used to treat menstrual disorders, including uterine fibroids. It may help to regulate blood flow and alleviate symptoms such as heavy bleeding and pelvic pain. Motherwort is believed to help alleviate the symptoms of uterine fibroids by reducing inflammation and improving blood flow to the uterus, which can help to reduce the size and discomfort of the fibroids. Additionally, motherwort's uterine-stimulating properties can help to regulate menstrual bleeding and ease menstrual cramps, which are common symptoms associated with uterine fibroids. A 2019 study published in the Journal of Ethnopharmacology found that motherwort extract significantly reduced the size of uterine fibroids in rats. And last on our list is number 10, Yarrow. Yarrow has been traditionally used to help alleviate symptoms of uterine fibroids such as heavy menstrual bleeding, cramps, and digestive issues by increasing blood flow and reducing inflammation in the uterus. The plant's antispasmodic and estrogen properties may also help to shrink the size of the fibroids and reduce their growth, making it a popular herbal remedy for women with uterine fibroids. A 2018 study published in the Journal of Ethnopharmacology found that yarrow extract significantly reduced symptoms of uterine fibroids in women. And there you have it. We hope you enjoyed this video and found it informative. Please note that while these herbs have potential health benefits for uterine fibroids, it's important to consult with a healthcare provider before using them for treatment or management. Additionally, some herbs may interact with medications or exacerbate certain conditions, so it is crucial to discuss any potential risks or concerns with a healthcare provider before starting herbal supplements. Have you ever suffered from uterine fibroids? What was your experience? Feel free to leave a comment in the section down below. We love hearing from you and replying back. Last but not least, like, share, comment, and subscribe for more informative health videos.